Backed by more than 4 decades of experience as a pharmacist, Joel Seth Aronson, RPH, is highly regarded for his work ethic, compassion, and knowledge. Mr. Aronson developed an early passion for mixing ingredients together and eventually bought a chemistry set, foreshadowing his eventual entrance into the pharmaceutical industry. He graduated from Plain Edge High School in New York in 1967 and went on to attend the College of Pharmacy at the University of Louisiana at Monroe, where he obtained a Bachelor of Science in Pharmacy in 1972. In the early years of his career, Mr. Aronson worked at a pharmacy warehouse for Eckerd Drugs in Florida during his senior year in college. Later, Mr. Aronson worked as a pharmacy intern at Stevens Pharmacy and as a pharmacy graduate intern at Brookline Pharmacy in order to obtain his pharmacy licenses in Louisiana, Massachusetts, and Florida. He began working full-time in 1974 as a staff hospital pharmacist at Boston City Hospital in Boston, Massachusetts, where he remained for 22 years until 1996. Alongside his primary position, he was elected as a union shop steward and was also on a joint steering committee which oversaw the merger of Boston City Hospital with Boston University Medical Center to become Boston Medical Center. While working at Boston City Hospital, a particularly memorable moment was having to go to work during a blizzard in Boston in 1978. No buses or above-ground trains were running, so he walked from his apartment in Revere to the underground nearest station. From there, he was able to catch an underground train and then trudge through the snow to get to the hospital, then tending to his daily duties. For his dedication to his patients, he received a commendation from Boston City Hospital for his exemplary efforts. In addition, Mr. Aronson, along with 2 colleagues, once endured an unsuccessful armed robbery of narcotics at the hospital while working a weekend shift. In 1996, Mr. Aronson transitioned into a full-time staff hospital pharmacist role at Boston Medical Center, where he was elected as a union shop steward and was a member of the Family Patient Education Steering Committee. He held this position until 2002. From there, in 2003, he was active as a part-time pharmacist at Family Med Pharmacy, CVS ProCare, Costco Pharmacy, and Target Pharmacy before joining the Veterans Affairs Medical Center in Providence, Rhode Island. At the VA Medical Center, he excelled as a full-time staff clinical pharmacist from 2004 to 2011 and as a clinical pharmacy specialist from 2011 to 2019. In this post, he verified physicians' orders and maintained responsibility for discharging and counseling veterans until commencing his retirement in 2019. For his success in this position, he was notably recognized with an Eye Care Leadership Award pin from the United States Department for Veterans Affairs. To remain current in his field, Mr. Aronson maintained professional memberships with the American Pharmacists Association, the Massachusetts Pharmacists Association, the Massachusetts Society of Health System Pharmacists, and the American Society of Health System Pharmacists. Attributing his success to being compassionate and a good listener, he is proud that pharmacists are being recognized as an essential part of the healthcare team. His advice to pharmacists and all healthcare professionals alike is to treat patients fairly. Additionally, he adds that it is crucial to ensure that a pharmacist's work is complete and error-free, and that the pharmacist can follow policies and rules without management supervision. Despite being settled in his retirement with his wife Roberta and son Michael, Mr. Aronson continues to contribute to his community and those in need as a volunteer trainer for pharmacy students, pharmacy technicians, and pharmacy residents.